Your team has recommended surgery as part of your lung cancer treatment. Here is what that actually involves. Lung cancer surgery removes the tumor with a margin of healthy tissue and the lymph nodes that drain that part of the lung. Surgery is most often offered for early-stage non-small cell lung cancer and sometimes for locally advanced disease with added drug treatment. Before surgery, doctors check that your lungs and heart can cope using breathing tests, an ECG, and sometimes an exercise test. Surgeons choose how much lung to remove: a wedge, a segment, a whole lobe, or rarely an entire lung. Most early-stage operations today use minimally invasive keyhole methods, small incisions, a camera, and long, thin instruments. Under general anesthesia, the surgeon divides the vessels and airway, removes the diseased tissue, and takes lymph node samples. 1 or 2 chest drains are placed to remove air and fluid and stay in until the lung is fully re-expanded. Hospital stay for keyhole lobectomy is usually 3 to 7 days, with breathing exercises and walking starting on day 1. At home, recovery unfolds over weeks. Light activity early, most routine tasks by 6 to 8 weeks. Risks include prolonged air leaks, pneumonia, irregular heartbeat, blood clots, and some lasting reduction in lung capacity. Depending on final staging and tumor biology, chemotherapy, targeted therapy, or immunotherapy may be added before or after surgery. After curative surgery, doctors typically schedule regular scans every 6 months for the first years to watch for recurrence. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe, for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.